Welcome to Back to Health. I'm glad you've discovered us. Before we get started, I wanted to talk a little bit about what exactly neurologic focused chiropractic is and what makes us unique. Neurologic focused chiropractic is the best of two worlds, the first being traditional chiropractic and the second functional neurology. Traditional chiropractors strictly focus on the movement of the spine and have limited diagnostic or outcome assessments, focusing solely on the movement of the spine or malpositions seen on x-rays. Furthermore, many chiropractors adjust with their favorite technique that are not necessarily individualized for specific patients and conditions. On the other hand, many functional neurologists are focused on things like traumatic brain injury, migraines, vestibular problems, and spend little of their time focusing on the importance of the spine. At Back to Health, we offer the best of both worlds. We have the in-depth understanding of the nervous system and how different inputs affect the brain and central nervous system. But also don't forget about the power of a specific chiropractic adjustment. This means at Back to Health, we are able to take care of you and your specific challenges, whether that be ordinary mechanical spinal pain or complex cases like chronic pain, numbness, or tingling, cognitive challenges, dizziness, digestive, immune, blood pressure challenges, or even learning, social, behavioral challenges, and developmental delays in children. Before we get started with our approach, let's have a brief discussion of the nervous system. Understand that the nervous system controls the function of every system, organ, cell in the body. Most of this is performed through the autonomic or automatic nervous system. The part that is not necessarily under your control or your awareness, for example, your heart pumping, breathing, kidneys, filtering, etc. To keep things simple, your autonomic nervous system is divided into two parts, each equally important. We have the sympathetic side, gas pedal. This is the fight, flight, freeze side. We also have the parasympathetic side, brakes. This is the rest, digest, recover side of your autonomic nervous system. While both sides are important, for example, if you're being chased by a tiger, you want your sympathetics to kick in so that you can fight or run away. However, equally important is your parasympathetic side, so that you can recover from that stressful situation. So far, so good? Let's talk about where subluxation fits in. Subluxation is a stuck or malpositioned vertebra affecting the nervous system. In chiropractic, we often talk about the spine being the motor to the brain. What this means is that through normal motion of the spine, proprioceptive and mechanoreceptive input ascends to the brain. You see, these nerve fibers run faster than pain fibers. It's kind of like when you hit your funny bone and rub it. It feels better. However, when vertebrae get stuck or lose their normal motion, we get pain or nociceptive input into the primitive brain. The primitive brain or amygdala registers this as bad input and activates the sympathetic or fight or flight reaction. And many times the nervous system gets stuck in this fight or flight response, and over time it can exhaust the nervous system. Think about it. If you were being chased by a tiger, your blood pressure would elevate, your respiration rate would increase, and your body would shunt its energy and blood from the organs to the larger muscles of your arms and legs so you could fight or run away. This, of course, would affect your ability to digest, your blood pressure, your recovery, your sleep, the functions of your organs, as well as put you into a constant state of anxiety or burnout. At Back to Health, we use the Insight neurologic scans to evaluate the overall stress and balance of your nervous system. Using HRV, heart rate, skin conduction, and thermography, we are able to evaluate autonomic output. EMG is used to look at the neuromotor output of your brain. This technology gives us an insight into your nervous system, as well as allows us to target specific areas of disruption. Depending on your specific challenges, we may also follow up with an appropriate tableside examination. This information allows us to surgically target and correct disruptors of the nervous system and build a care plan specific to your challenges and goals with the use of state-of-the-art equipment and specific chiropractic techniques.